Okay, go ahead.
All right, osteopathic medicine presented by Charlie Allred and Maddie Steele. So what is osteopathic medicine? The major focus of osteopathic medicine is preventative care, manipulative medicine, communication with the patient, and a holistic approach to care. Osteopathic medical education has an emphasis on structure and function. The hands-on approach sets osteopathic medicine apart from allopathic medicine. A key difference in osteopathic medicine is the use of osteopathic manipulative medicine. The main emphasis of osteopathy is to restore motion to all parts of the body so as to regain healthy function. This includes joint and soft tissue motion, crystal and nervous system motion, and the flow of blood and lymph to ensure the delivery of nutrition and oxygen, and the removal of toxins as well. Osteopathic manual practitioners use safe, gentle, and precise techniques to restore motion. They alleviate strain, reduce pain, restore a restful state, really to promote healing and bring the body into a healthy balance. So now let's look at the roots of this division of medicine. The father of osteopathic medicine is Dr. Andrew Taylor Still. He was born in Virginia in 1828. His father was a Methodist minister as well as a physician. Early in his childhood, Dr. Still decided to follow in his father's footsteps and become a physician as well. He studied medicine and served as an apprentice under his father before he became a licensed MD in Missouri. In the early 1860s, he went back to school at the College of Physicians and Surgeons in Kansas City and then began his service as a surgeon in the Union Army during the United States Civil War. After the Civil War, 3 of his children died from spinal meningitis. Around 1864, Dr. Still concluded that typical medical practices were useless and frequently did more harm than good. So at that point, he began studying the human body and finding better ways to treat disease and illness. So who are some of the more principal figures in the development of osteopathic medicine? When Dr. Still's children died, he began to question the efficiency of the current methods of treatment. Of course, in those days, treatment included what is known as heroic attempts, which include procedures such as bloodletting and other methods that are considered extreme today and which are no longer allowed. During his rethinking of medicine and treatment, Dr. Still began to look on his experiences studying human and animal anatomy and eventually developed a practice of what he called medical manipulation, which is now known as osteopathic manipulative medicine. After healing a skeptical minister's daughter by his manipulative medical techniques, people flocked from all over to be treated by Dr. Still. Another key influence on osteopathic medicine was Dr. Irvin Core. As a somewhat young man of 35, Dr. Core was convinced that he would die fairly early, as his father had before him. He felt like an old man, and his body and general health were very much that of an older man. Then he met a doctor of osteopathic medicine who helped to turn his life around, both physically and mentally. This was done through weekly visits by applying osteopathic manipulative procedures designed to gradually restore freedom of motion in every part of his musculoskeletal system, including the neck and rib cage. During these visits, Core was introduced to the EO concept of personal responsibility for his own health through things like exercise, stretching, bending, as well as abdominal breathing exercises to enhance his diaphragm's respiratory role. After several treatments and home exercises, his neck had become more flexible and more nearly erect. The following evening, he found that he could delegate responsibility once again to his reflexes. A few weeks later, he was out walking briskly, more than usual, and felt the need to take a deeper breath and was experiencing none of the accustomed resistance. He took what he said must have been the very first full breath of his entire life. He wrote about this experience, saying it was so emotional and so enormous that he leaned against a tree and sobbed with total abandon for some time, and then walked home in utter peace. This changed his life as he then began to attribute the enormous improvement of his body's flexibility, the freedom of motion, and being able to breathe as the result of his osteopathic treatments. He then went on to publish extensively and learn more about Still's concepts, and began tying osteopathic concepts together with proven physiologic models that emphasize the important roles played by the musculoskeletal system. Whereas Still emphasized a focus on the bones as the starting place of pathology, Core expanded this concept to the spinal cord and its relationships with the musculoskeletal and the sympathetic nervous systems. Eventually, he was nominated for the Nobel Prize for his work. And as we know who some of the principal figures were, but another key figure was Abraham Flexner. Next slide. Abraham Flexner was not a doctor, but he was a secondary school teacher and a principal for 19 years in Louisville, Kentucky. This was where the writer's uncle was one of his students. Flexner took graduate work at Harvard and the University of Berlin and joined the research staff of the Carnegie Foundation for the Advancement of Teaching. For that foundation, Flexner researched, wrote, and in 1910 published a report entitled Medical Education in the United States and Canada. It is known today as the Flexner Report. Written by Abraham Flexner in 1910, the Flexner Report was a study on the condition of the medical education of the era. Through his report, he was able to cast a light on the need for current medical schools across North America. He criticized them for being a, quote, loose and lax apprenticeship system that lacked defined standards and goals beyond the generation of financial gain. He compared North American schools to those in Germany that were much more hands-on and focused on biomedical sciences, and flex schools to close down, and the remaining form their whole curriculum. Next slide. The Flexner Report had an aftermath. A physician received at least 6 and preferably 8 years of post-secondary formal instruction since the creation of that report, nearly always in a university setting. Another aftermath from that report was medical training adheres closely to the scientific method and is thoroughly grounded in human physiology and biochemistry. Medical fully to the protocols of scientific research. Average physician's quality has increased significantly since that report. No medical school can be created without the permission of the state government. Likewise, the size of existing medical schools is subject to state regulation. Each branch of the American Medical Association has oversight over the conventional medical schools located within the state, and medicine in the US and Canada has become a highly paid and well-respected profession since the creation of the Flexner Report. So, we now know some of these key figures. So the beginning of the osteopathic medical field began with the American School of Osteopathy, beginning in Kirksville, Missouri in 1890. Its founder was, of course, Dr. Andrew Taylor Still. Here we see the original school and its first graduating class of DOs. Today, there are osteopathy schools all over the country and around the world. Although it wasn't until 1973 that doctors of osteopathic medicine were eligible for licensure in all 50 states and the District of Columbia. Next slide. Osteopathic medical education has grown since that first school. The American Osteopathic Association's Commission on Osteopathic College Accreditation currently accredits of osteopathic medicine offering instruction at 48 locations in 31 states. I myself was interested to see that there is now a school of osteopathic medicine in my town of San Antonio, Texas. The DO I spoke with, Dr. J. Benfield, was very excited about it, saying it just recently opened. He felt its addition would do a lot for osteopathic medicine in San Antonio and the surrounding areas. However, despite schools being located all over the country, DOs make up less than 10% of practicing physicians in the United States. There are approximately 800,000 practicing physicians in the US. MDs make up about 750,000, while currently 50,000 are DOs. So now that we know where we can attend DO school, how does osteopathic training differ from traditional medical school training, and why is there a separate degree for DOs? Physicians licensed as doctors of osteopathic medicine, or DOs, like their MD counterparts, must pass a stringent national or state medical board examination in order to practice medicine. Osteopathic physicians use all of the tools available through modern medicine, including prescription medicine and surgery. They also may use OMM, or osteopathic manual manipulative procedures, techniques to diagnose illness and injury, relieve pain, restore range of motion, and enhance the body's capacity to heal. Reflective of the osteopathic philosophy of treating the whole person, many DOs serve in the primary care fields, family medicine, general internal medicine, and pediatrics. However, it is mostly their knowledge of OMM techniques that set them apart from MDs and require more education and certificates. I spoke with a DO about why he became a DO. Dr. J. Benfield attended school at Midwestern University, Arizona College of Osteopathic Medicine in Glendale, Arizona. I asked him a couple of questions about being a doctor of osteopathic medicine. My questions were why he chose to become an osteopath rather than an MD. Does he feel that there are important differences? And if so, what are those differences? He started out by telling me I wanted to do something with joint medicine. I did a lot of work previously with orthopedics, and I liked the procedures and hands-on medicine. One of his favorite things about DO training was that in school he got to do a lot of hands-on medicine. He learned a variety of skills related to physical therapy, chiropractic, and even some massage therapy, and learned from those specialists. In making his decision on whether to attend a traditional medical school or an osteopathic medical school, he ordered curriculum booklets from dozens of schools of both varieties across the country. He said, I didn't find the curriculums to be that different, other than the exception of the significant blocks of time for the hands-on medicine. That, of course, appealed to me. He shared a story about his father who strongly urged him to attend a traditional medical school. He was rather opposed to osteopathic medicine. During this period of trying to choose, one Sunday while Dr. Benfield was visiting his parents at church, his dad had an asthma attack. He'd struggled with complications from asthma for a number of years with little relief. He took his father to the hospital, and because it was a Sunday, there was minimal staff, and the doctor available happened to be a DO. He examined the man, and with the help of some manipulative medicine, his dad instantly felt relief like never before. The next day, he told Dr. Benfield he should seriously consider going into osteopathic medicine. Next slide. I spoke with the DO about manipulative medicine, and I asked him what made him choose osteopathic medicine, and he said with much delight, I might add, I really liked the hands-on approach. I wanted to go into spine and joint specialty. I knew the extra training would be essential, especially because there is a growing population of patients who don't want surgeries, they don't like needles, or they don't want more medications. Usually I see a handful of people a day that don't want another medication or another injection. Manipulative medicine is really beneficial for those kinds of patients. And he added, it's a lot of fun. He explained that DO schools will teach all the different techniques from specialists in physical therapy, chiropractic medicine, and even massage therapy. As a DO, you can then pick and choose what you want to use in your career. Dr. Benfield uses whatever knowledge he can to help treat his patients. Next slide. So another question that I asked him was if there were any feelings of competition between MDs and DOs, and he gave me a really simple answer: no and yes. He told me, I don't think I've ever had to worry about it myself. However, those MDs or DOs that are over 50 years old, they dealt with it. There used to be only MD hospitals or only DO hospitals. They did so because one would think that the other wasn't good enough. The DO I interviewed was trained by both MDs and DOs in co-facilities and never saw any feelings of competition or superiority between the two. However, he did mention that he was turned down for a residency in Colorado that he was more than qualified for because he was a DO and not an MD. He finished by saying, nowadays, most states have the same medical boards. However, some states like Arizona still have separate medical boards, which contributes to any feelings of superiority by some MDs. And that is the end of our presentation. I hope you have learned more about osteopathic medicine and the difference between MDs and DOs.
Awesome. Great work. There's definitely a lot of research and effort that went into creating that. Very great job. Before I'm done recording, I do like to ask everybody a question. So Charlie, I'll ask you, and then Maddie, it will be the exact same question, but it's really simple. It's, what was the most interesting thing that you learned as you were studying this topic?
So I actually really liked when I spoke with Dr. Benfield. He was really enthusiastic about his job. He was really enthusiastic about the things that he learned in school. I thought it was fantastic that he had the experience with his dad of his dad being pretty against him being a DO and then happened to be treated by a DO and completely changed his mind. It kind of opened my eyes a little bit to osteopathic medicine. Really, I had to look it up. I had no idea what osteopathic medicine was. And so the more I read about it and kind of where it came about, and then talking to Dr. Benfield, it was something that I thought I would like to look into more for even my own personal physician. It makes a lot of sense to me, and so that was really cool to be able to learn something that I could potentially relate and use in my own life.
Awesome, great. All right, Maddie, same question.
Well, I think the most fascinating thing, just like what Charlie said, it's something that I can relate to in the way that I really enjoyed the way they went about treating the patient. A lot of what I read was just saying that, like, instead of just treating the symptom that a patient comes in with, they try and treat, okay, so how can we fix this issue and also make sure it never happens again and make sure that you can live a better life. So they kind of go, 5 steps ahead as well. And I think that was the most fascinating thing for me, because right now my husband is working as a physical therapy tech. And so just the parts when, learning about how they just learned that exercise and moving your body and doing certain things help a ton instead of just, take this drug to get rid of your headache. So it's just kind of fascinating, because I think that's the way our world is, like the fitness world and, the medical world is kind of gearing towards more of a holistic approach of, try and just, fix it before it happens. And I really liked that.
Awesome. Well, great work. I'm going to go ahead and stop recording, but hang on here for just a second.